I'm Dato' Dr. Abdul Wahab bin Abdul Ghani. I am an orthopedic surgeon. I've been working in Ampang Puteri Specialist Hospital for the last 16 years. And one of my interests in orthopedics is sports surgery, dealing with sports injuries and how to remedy the problems. One thing good about the joint these days is that most of the surgeries can be done arthroscopically. The procedures can be done with minimally invasive techniques, and one of those techniques, we call it arthroscopic, because we actually remedy the damage by putting a scope into the joint, and we work through the scope using a camera and also another portal, one or two portals for introduction of instruments. Okay. Now for fractures, of course, as usual, fractures in the joint must be fixed accurately, and the anatomy of that joint must be restored. Okay. To mimic the original morphology of the joints. Okay, so that's the best. We can do that by fixation, of course, internal fixation using plate and screws and whatnot. Now for the ligaments, we can repair them or we can reconstruct them. Repair means we open up. Let's say if the lateral collateral, or the simpler one is the medial collateral, is torn, we have to open. We cannot do arthroscopically because these ligaments are outside the knee. So we have to open the ligaments, by making a cut over the ligament, and then repair of the ligament as an open technique. So the repair can be done depending on where the tear is. If the tear is in the mid-substance, we can repair by end-to-end stitching, or if it is a valse or detached from the origin or insertion, we can fix it back by using some method of internal fixation like screws or stapling. Now, so are the other ligaments on this side, the lateral collateral. We can do about the same procedures, but for the ligaments that is inside the knee and the injuries are more common, the ACL and the PCL, there's no way we can repair them. Okay, so most of the time we get a mid-substance tear, and in such an instance, we have to reconstruct the ligaments. We cannot repair them. We cannot reuse the old ligament, but we have to replace the ligament with some other spare parts, taken either from the patient, or we can use other materials or other biologic materials like allograft and so on. Now, so that is called reconstruction. Okay. Now for the ACL, which is one of the commonest ligament to get torn, we can either use the patella tendon, which you can harvest the central third of the patella tendon, or we can use hamstring tendon, which are situated on the medial, or more specifically we call it anteromedial side of the tibia. You can harvest that, or we can also use allograft. Okay, and these can be done arthroscopically without even opening the joint. Okay, except for the area where we're going to harvest the graft from. Okay, the rest of the surgery are arthroscopically done. Now, damage to menisci can be repaired because, okay, it all depends on the type of tear. If the tear is a peripheral tear, or a tear along the